ABC Meds. Today we'll be talking on cardiovascular pathology. Now, when talking about the cardiovascular system, you're talking about cardio, which is the what? The heart. And you're talking about the vascular part, which is what? The vessels. And it's important for you to start cardiovascular system by talking with the vessels because vascular diseases lead to heart diseases. Now, when you go into the vascular pathology section, you have two major diseases that can occur in the blood vessels. You have vasculitis and you have ischemic heart disease. Now, ischemic heart disease are usually due to arteriosclerosis, which I think most med students are used to. Arteriosclerosis, which is pretty much when you have fatty, deposits in the blood vessel leading to organ ischemia. Now, the one we'll talk today, we'll focus on is vasculitis, and this is what we are going to talk about. Vasculitis, like the last, few letters implies itis is what we know as inflammation. So pretty much in vasculitis, we have inflammation of the blood vessel wall. As you can see from my diagram here, where this red discoloration that I use here is used to imply that there's some kind of inflammation. Now, if we go deep, we would see that this vasculitis would cause disruption. Disruption of what? Of the endothelium of the blood vessel layer. Now, the blood vessel has three layers. It is the inner layer of the blood vessel is lined by what we call endothelial cells, as you can clearly see from this diagram, that sits on a basement membrane. Now, underneath the intima, which is we call this endothelial and basement membrane, the intima layer, we have the media, which is made up of mostly smooth muscle cells, and maybe some connective tissues as well. Then finally, outside of that, we have the adventitia, which is mostly just connective tissues down here. So now, when you have vasculitis, you will disrupt this endothelial layer. As you can see, these cells are disrupted, and once cells are disrupted, you open up the blood vessels and you expose the medial layer. And remember, in the medial layer, you have smooth muscles as well as some collagen as well. So exposing this subendothelial collagen will trigger thrombosis to occur. So it can trigger the coagulation cascade, and you can form a blood clot, a lump of blood clot that can later on occlude these blood vessels and vasculitis and cause organ ischemia. As well as the other way that you can get an organ ischemia from vasculitis is after having series of inflammation in this blood vessel, it would later progress to the next thing after vasculitis that will occur will be healing, because the endothelial cell will try to heal themselves, and in this case, after continuous series of inflammation, they will heal themselves using fibrosis. So this inflammation will turn into more of a scar-like tissue. So you have this fibrosis, which will cause very thickening of the blood vessel, and this continuous thickening here would lead to a decrease in blood flow. As you can see, this is blood flowing here, and now it has to go through this tiny lumen due to this fibrosis that occurred due to series of inflammation in that blood vessel. Now, one thing about vasculitis that we should know is the general features of vasculitis. How would it present? Now, most vasculitis, of course, will present with the general fever, malaise, symptoms of inflammation, weight loss, and myalgias. So about these myalgias is just muscle pain and all that. So these are just the general symptoms that you see with all vasculitis, which are pretty much, because all vasculitis, remember, are inflammatory conditions. So we would see these classic symptoms: fever, malaise, weight loss, and myalgias. Now, then you go into specific symptoms. Why would you go into specific symptoms? Because most different vasculitis affect different vascular beds. Vascular beds. Examples, let's say Kawasaki. Kawasaki is one of the vasculitis that likes to affect the heart. It will affect the coronary arteries, and therefore you would present more with symptoms of organ ischemia, ischemic heart disease and all that. So that is what we should know, that vasculitis presents with a general symptom, which is symptoms of inflammation, and then it presents with symptoms specific to the organs that the vasculitis would affect. Now, grouping of vasculitis, we group vasculitis into three broad classes. We have the large vessels, we have the medium vessels, and finally we have the small vessel vasculitis. This is just based on the vessels we have in the body. An example of large vessels, we have the aorta, a very large vessel in the body. Then we talk about the medium vessels, the vessels that feed the organs, your renal artery, your pulmonary artery, and all those arteries that feed the organs directly. The mesenteric artery that feed the gut, those are your medium vessels. Then you have the smaller vessels, which are your arterioles. Your arterioles that branch out to give you your capillaries. So these are areas where you will see what vasculitis. Now, before I forget to mention, right, you can have inflammation in your arteries and in your veins. But whenever you talk about vasculitis, it's pretty much just arteries. So you're talking about arteries altogether. So when you talk about large vessel vasculitis, you mean inflammation of the large arterial blood vessels. Medium vessel vasculitis, inflammation of the medium arterial blood vessels. Small vessel vasculitis involve inflammation of the small blood vessels. Now, let's go on to talk about these individually. Now, what are the vasculitis you see in large vessel vasculitis? Pretty much you just see two here. And the two that you see is TGA, short for temporal giant cell arteritis. Then the other one is TK. I have written as TK, which is TKA, Takayasu arteritis. So those are the two large vessel vasculitis that you should concern yourself with. The next vasculitis is the medium vessel vasculitis, and the first in this group is your PAN, polyarteritis nodosa. That's something that we should know. The next in this group is your Kawasaki. Remember, you think Kawasaki, think Asian kids. Kawasaki, and the final medium vessel vasculitis is Borger's disease. Borger's, some people call it Borger, some people call it Borger's. Anyone that floats your boat, you just need to know that you have something called Borger's or Borger disease. Now the spelling might be wrong, so don't crucify me for that. Then finally you have your small vessel vasculitis, and under your small vessel vasculitis, you have groups of different vascular pathologies that can arise from this. You have your microscopic polyangiitis. You have your shock stress. You have your shock stress as well. And you have another vascular pathology, which actually forgot. Oh shit! I actually forgot it. I have to call this part out. Oh, there's one more medium vessel vasculitis, I think. And that's the most important. Wegener's. Okay, don't worry. I'll just call that section. And you have your Wegener's granulomatosis. Oh, actually, I can you pause it? Is it paused?